Hi everyone, happy to see you all after a long break with a very important and excellent topic. Yes, the topic is autism. How many of you are aware of the term autism? What do you know about autism? Give a comment below. Why am I posting this video today? Yes, because today, 2nd of April, is Autism Awareness Day and April is Autism Awareness Month. Autism is becoming a very common term in today's world. It is important for us to be aware about autism. Being aware and acting appropriately can bring changes in many people's life. It is time for us to accept people with autism without any second thought. To begin with, what is autism? Autism is not a disability. It is a different ability. Autism is a developmental disability that affects the way people communicate, behave, or interact with others. It is a developmental disorder. Once a child is diagnosed with autism, the child will exhibit autistic behaviors even in adulthood. But the behaviors would vary according to the severity. The cause is not specific. It can be genetic, non-genetic, or environmental influences. The signs and symptoms of autism are: the child will exhibit minimal or no eye contact. They will prefer to play alone. They will not point at objects or show interest in any of the objects. They'll have a delay in speech and language skills. They'll be very sensitive to specific light, sound, smell, taste, touch, etc. They will exhibit abnormal body movements. They will become obsessed with certain interests. They will resist to any slight changes in the daily routine. They will repeat words or phrases continuously. Early identification of autism is very important to provide appropriate early intervention. Early intervention can help a child to improve better and live a life that is as normal as possible. The early signs can be identified by the age of 18 months, though autism can be diagnosed only by 3 years of age. Identifying the features early will help in planning the future. Signs to notice in children less than 2 years are: no social smiling by 6 months, no one-word communications by 16 months, no two-word phrases by 24 months, no babbling, pointing or meaningful gestures by 12 months, poor eye contact, not showing items or sharing interests, unusual attachment to one particular toy or object, not responding to sound, voices or names, loss of skills at any time. We need to observe regression too. That is, a child who was speaking one word may stop speaking, or any skill achieved might not be performed anymore. If you feel your child or anyone in your community has the above mentioned symptoms, please do contact a pediatrician, speech language pathologist, psychologist, occupational therapist or other related professionals as soon as possible. There is no cure for autism, but it can be managed by providing appropriate management for its symptoms. Managing the symptoms is very important for improving the skills of the child with autism. The various management options include behavioral therapy, speech and language therapy, special education, family therapy, and medications for the symptoms. Autism is not a disease. Don't try to cure it. Try to understand it. Now, the most exciting thing is we at Neville are providing free consultations for this entire month. You might not be in need, but there are many people in your community who will be in need, so please share this news with others. Let them use this opportunity. See you all in the next interesting video. Take care, keep smiling.